you ever wondered what goes on in the mind of a psychopath or sociopath? This question leads us to a deep exploration of antisocial personality disorder, or ASPD, the clinical diagnosis behind such complex psychological conditions. The symptoms and behaviors of ASPD are not only elusive, making them difficult to spot, but are also far more common than we might like to think. In today's discussion, we aim to shed light on this complex psychological phenomenon. So, what causes antisocial personality disorder? Is it a product of nature or nurture? This question has sparked debates within the psychological community for years. The nature versus nurture debate centers around whether our behaviors and traits are primarily influenced by our genetics, nature, or our environment and experiences, nurture. When it comes to antisocial personality disorder, or ASPD, the answer isn't as straightforward as one might hope. There's compelling evidence suggesting a combination of both genetic and environmental factors. Let's delve a bit deeper into this. On the genetic side, research shows that ASPD tends to run in families. This pattern hints at a possible genetic predisposition to the disorder. Certain genes associated with aggression, impulsivity, and indifference to others' feelings, traits often exhibited by individuals with ASPD, have been identified. However, genetics isn't the whole story. Environmental factors play a significant role too. For instance, individuals exposed to neglect, abuse, or a chaotic home environment during their formative years are at a higher risk of developing ASPD. This points to the impact of nurture, or the environment, in shaping antisocial behaviors. But the environment isn't just about adverse experiences. It's also about the absence of positive ones. A lack of positive role models, nurturing relationships, or stable routines can create a breeding ground for antisocial behaviors. Moreover, the interaction between genetics and environment is crucial. A person with a genetic predisposition to ASPD might never develop the disorder if they grow up in a supportive, nurturing environment. On the other hand, someone without such a predisposition might still develop ASPD if they're subjected to severe, ongoing environmental stressors. So, to answer the question, what causes antisocial personality disorder? We need to look at both nature and nurture. It's the intricate interplay between our genes and our environment that shapes who we are, including whether we develop disorders like ASPD. While the debate continues, one thing is clear. Both genetics and environment play a crucial role in the development of ASPD. What goes on in the brain of a psychopath or sociopath? Can they feel remorse or empathy? This question has intrigued psychologists and neuroscientists for years. It's now widely accepted that there are indeed neurological differences in those diagnosed with antisocial personality disorder, or ASPD, the clinical term for psychopathy and sociopathy. The human brain is a complex and intricate structure, and certain areas are associated with our ability to empathize and process emotions. In individuals with ASPD, these regions often show a significant divergence from what is considered normal. This divergence is not only fascinating, but also provides vital clues to understanding their behavior. One key area of difference is the amygdala, often referred to as the brain's emotional center. Studies have shown that the amygdala of those with ASPD is often smaller and functions differently. It has a reduced response to fear and distress signals, which can explain why psychopaths and sociopaths might lack the normal emotional responses most of us experience when we see others in pain or distress. Another critical area is the prefrontal cortex, responsible for decision-making, impulse control, and understanding the consequences of our actions. In those with ASPD, this region is often impaired, leading to impulsive behavior, poor decision-making, and a lack of understanding or caring about the consequences of their actions. The fascinating thing is that these neurological differences don't just affect behavior. They also impact the ability to feel empathy and remorse. Notably, research has shown that individuals with ASPD often struggle with feeling empathy, especially when it comes to understanding other people's emotions. This struggle can make it challenging for them to feel remorse for their actions, as they simply don't fully grasp the emotional impact of what they've done. So to answer the intriguing question we started with, it seems that the brains of those with ASPD function differently, leading to behavioral differences and a lack of empathy and remorse. It's crucial to remember, however, that this is not a choice they make. It's a result of differences in their brain structure and function, which they have no control over. The brains of those with ASPD function differently, which can lead to a lack of empathy and remorse. Let's delve into the signs and symptoms of psychopathy and sociopathy. It's important to note that these signs can be subtle, and not everyone who exhibits them has antisocial personality disorder, or ASPD. One of the most significant signs is a pervasive pattern of disregard for the rights of others. This might manifest as a failure to conform to social norms and laws, leading to arrests or legal complications. It might seem like the person is constantly in trouble or bending the rules to suit their needs. Next on the list is deceitfulness. Individuals with ASPD often display manipulative behavior, lying for personal profit or pleasure. They may be charming and charismatic, using these traits to manipulate others for their own gain. Another telling sign is impulsivity or failure to plan ahead. People with ASPD often act on the spur of the moment without thinking about the consequences. This can lead to risky behavior and a reckless disregard for their own safety or the safety of others. A lack of remorse is also a key symptom. After hurting someone else, whether physically or emotionally, a person with ASPD might feel no guilt or remorse. They might even blame their victims or rationalize their actions. Furthermore, they may show signs of irritability and aggressiveness. Frequent fights or assaults could be a symptom of ASPD. Then there's the consistent irresponsibility. This could be as obvious as repeated failure to fulfill work obligations or more subtle like neglecting family duties. And finally, a lack of empathy. They might seem cold and indifferent to the feelings of others. They may have a hard time understanding or sharing the feelings of others, which can make them seem self-centered or callous. Remember, these signs can be easily mistaken for other traits or behaviors. It's crucial not to jump to conclusions or label someone as a psychopath or sociopath based on these signs alone. Professional diagnosis is key. Recognizing these signs is crucial in identifying individuals with ASPD. The more we understand, the better we can support those affected and protect ourselves and others from potential harm. How do you tell if your friend, co-worker, or even your spouse is a psychopath or sociopath? A daunting question indeed, but the answer lies in understanding the nuances of antisocial personality disorder and its manifestations in everyday life. It's important to acknowledge that we all exhibit a range of behaviors and emotions. However, what sets an individual with antisocial personality disorder apart is the consistent pattern of disregard for the rights of others. This might manifest as persistent lying, manipulation, and a lack of remorse for their actions. Let's take an example. We all have that one friend or co-worker who loves to be the center of attention. But if this behavior is coupled with an inflated sense of self-importance or entitlement, it might be a red flag. A psychopath or sociopath tends to believe they are superior to others and are often unfazed by the consequences of their actions. Now, it's crucial to remember that these signs are not a definitive diagnosis. They are merely indicators that something might be amiss. It's not our place to label someone as a psychopath or sociopath based on these signs. Instead, these insights should be used to protect ourselves and navigate our relationships effectively. For instance, if you notice these traits in someone, you might want to set boundaries to prevent manipulation. Or, if it's a close relationship, you might want to encourage them to seek professional help. One vital point to remember is that all of us have the capacity for change, so even if someone displays antisocial traits, it doesn't necessarily mean they're doomed to be a psychopath or sociopath. With the right support and treatment, they can learn to manage these traits and lead a fulfilling life. Understanding these traits can help us navigate relationships with potential psychopaths or sociopaths. It's about being aware, not paranoid. By recognizing these signs, we can ensure healthier interactions and relationships, and ultimately, a better understanding of the human psyche. Now let's explore the latest findings and research on ASPD, psychopaths, and sociopaths. In recent years, the field of psychology has made significant strides in understanding the roots and manifestations of antisocial personality disorder. Studies increasingly suggest that both genetic and environmental factors contribute to the development of ASPD, with a focus on the complex interplay between these elements. Research has also highlighted the role of brain structures in contributing to ASPD. For instance, abnormalities in the amygdala, a part of the brain involved in emotional processing, have been linked to the lack of empathy and remorse often seen in individuals with this disorder. These findings suggest that ASPD might not just be a matter of wrong choices, but could be influenced by underlying neurological factors. A fascinating line of research is also examining the potential for non-invasive brain stimulation techniques, such as transcranial magnetic stimulation, to treat ASPD. While still in the early stages, this research holds promise for the development of novel, more effective treatments for this condition. In terms of diagnosis, advancements in machine learning and artificial intelligence are being used to identify patterns and correlations in behavior that could lead to earlier and more accurate identification of ASPD. This could potentially result in better prognosis and management of the condition. Studies are also investigating the role of therapeutic interventions, such as cognitive behavioral therapy, in managing ASPD. Preliminary findings indicate that these therapies can help individuals with ASPD to better understand and control their behaviors, although more research is needed in this area. Finally, research is delving into the societal implications of ASPD, exploring how education and policy changes can help in better managing and preventing this disorder. This includes efforts to reduce stigma and increase public awareness about ASPD, psychopathy, and sociopathy. Continued research in this field is essential to improving our understanding and management of ASPD. The hope is that these advances will pave the way for more effective treatments and interventions, ultimately improving the lives of individuals with ASPD and those around them. What if a child shows signs of ASPD? How should one handle this? This is a critical question, and one that requires an understanding of the complexities involved in diagnosing and managing antisocial personality disorder in children. ASPD is a severe disorder, and it's particularly challenging when it manifests in children. It's often mistaken for childhood rebellion or difficult behavior. However, the signs may be more persistent and harmful, like chronic lying, stealing, cruelty to animals or people, and a lack of remorse for their actions. Before jumping to conclusions, it's vital to seek professional help. Child psychologists and psychiatrists are trained to differentiate between normal childhood behaviors and potential signs of ASPD. Remember that only a qualified professional can make a diagnosis. It's not something to be decided based on internet research or personal assumptions. Dealing with a child who may have ASPD can be emotionally taxing. It's important to approach the situation with love, patience, and understanding. The child is likely struggling with their own internal conflicts and could be feeling isolated or misunderstood. Supporting a child with ASPD involves setting clear boundaries and consequences for inappropriate behavior. Consistency is key here. It's also crucial to reinforce positive behavior with praise and rewards to encourage more of such behavior. Educational and therapeutic interventions can also be beneficial. These might include cognitive behavioral therapy, which can help children learn to manage their emotions and behaviors, and social skills training, which can teach them how to interact appropriately with others. Remember, it's not about fixing the child, but about providing them with the tools they need to manage their symptoms and lead a healthy, fulfilling life. And finally, parents and caregivers should also seek support for themselves. Dealing with a child with ASPD can be stressful, and it's essential to maintain your own mental and emotional well-being. Support groups, therapy, and self-care strategies can all be valuable. Early intervention and support can significantly improve the outlook for children showing signs of ASPD. It's a challenging journey, but with the right help and approach, there's hope for a brighter future. How do you cope with a parent, co-worker, boss, sibling, or family member who has psychopathic or sociopathic traits? It's a question that can send shivers down the spine. Yet it's a question that we must confront head-on, armed with knowledge and understanding. Firstly, it's important to recognize that you cannot change someone with antisocial personality disorder or ASPD. Their behaviors and traits are deeply ingrained, often resulting from complex interplays between genetics and environment. This is not something you can alter. Acceptance of this fact can be a crucial step toward your own peace of mind. Next, let's talk about setting boundaries. Boundaries are essential when dealing with individuals with ASPD. These individuals often lack respect for other people's feelings or rights, making it necessary for you to establish clear lines of what is acceptable and what is not. This could mean setting limits on the time you spend with them, the topics you're willing to discuss, or the behaviors you'll tolerate. Remember, your boundaries are about protecting your own mental health, not about punishing the other person. Maintaining your own mental health is crucial in these situations. This might involve seeking support from trusted friends, family, or a mental health professional. You're not alone in this, and there are people who can help. It's also important to practice self-care regularly, whether that means taking time for relaxation, pursuing hobbies, or keeping up with physical exercise. One vital point to remember is not to take their actions personally. People with ASPD often act out in ways that can be hurtful or damaging to others, but it's crucial to understand that this is a reflection of their disorder, not a reflection on you. Finally, if the person's behavior becomes abusive or harmful, don't hesitate to seek help. There are many resources available, including hotlines and support groups, that can provide assistance in such situations. Coping with someone who has ASPD can be challenging, but with the right strategies, it is manageable. And remember, you're not alone in this. Reach out, seek support, and take care of yourself. You deserve it. Can someone with antisocial personality disorder recover or be cured? This is a question that often resonates in the minds of those affected by ASPD, directly or indirectly. The current understanding in the field of psychology is that there is no definitive cure for antisocial personality disorder. This might sound disheartening, but it's essential to remember that this doesn't mean there's no hope. While it's true that ASPD is a lifelong condition, it's also true that there are numerous management strategies that can significantly improve the quality of life for those living with this disorder. Therapy, for instance, can provide valuable coping mechanisms. Cognitive behavioral therapy specifically has shown promise in helping individuals with ASPD understand the impact of their actions on others and manage their symptoms effectively. Medication is another tool in the arsenal. While there's no specific drug designed to treat ASPD, certain medications can alleviate symptoms such as impulsivity or aggression, which are commonly associated with the disorder. Furthermore, support from loved ones is crucial. A supportive environment can help individuals with ASPD manage their symptoms, reduce harmful behaviors, and lead fulfilling lives. In conclusion, while it's a complex journey, recovery is possible. It involves a combination of professional help, medication when needed, and a supportive network of friends and family. The road may be long and winding, but with the right help and support, individuals with ASPD can navigate it successfully. While ASPD is a lifelong condition, hope and support can make a significant difference. Today, we've taken a deep dive into the world of antisocial personality disorder. We've explored its origins, the workings of a psychopath's brain, and the signs to watch out for. We've delved into recent research, discussed handling ASPD in children, and coping with psychopathic or sociopathic relatives or colleagues. We've even touched on the possibility of recovery. This journey underscores the importance of recognizing and understanding ASPD. Remember, knowledge is power. The more we understand about ASPD, the better equipped we are to cope and help others.